It's Dr. Jerome Corsi, and thank you for joining us on thetruthcentral.com. We're doing podcasts every weekday. You can find me on X at CorsiJerome1. You can find me in Substack. It's JeromeCorsiPhD.substack.com. I'm especially going to encourage you to look at the sponsors on thetruthcentral.com and pay particular attention to Swiss America. I'm really encouraging people to get some gold and silver. I think we're going to be experiencing a major economic downturn. And Chris, if you'll put up quickly the free book, I want people to go to the free book. We have a special interview today, and I'm going to focus this on a special interview. So this is just momentarily to get the book mentioned to you. Chris will show it to you. The coming global crash is going to cause an historic gold rush. And we'll get the number on the screen here in just a second. I'll give it to you. Our guest today is going to be Dr. David Hartsuch, and this is the second part of a two-part interview. Chris has got the book on the screen now. Chris will just give me the phone number. I'll read it. And toll-free number is 1-800-519-6268, 1-800-519-6268. Call Swiss America. You can get excellent consultative selling to see if gold and silver meets your financial needs, and if so, they can do even IRAs, where you can have self-directed IRAs and put some gold and silver into precious metals, which will diversify your holdings away from the stock market, which I'm very concerned could suffer a major crash in 2025, especially as this deep state globally retaliates against President Donald Trump's second term. They may just love to cause him a massive financial crisis. I suspect he'll be capable of handling it. But I don't want you to lose your IRAs and your 401ks. Dr. Hart says in the first segment, we covered kind of your background and how you got into medicine and your current practices. You're working with Robert Kennedy Jr., and I know you're being considered for a position in the health administration of the incoming Trump second administration, and I'm very much pulling for you to get a position there. And I want to now explore an area which has brought you and Bobby Kennedy together, along with another physician. His name is Dr. Edward Fogarty, Ted Fogarty, whom I got to know quite well. As I explained in the first segment, earlier this year when I wrote my book with David Mantik, PhD, MD, on the killing of the assassination of John F. Kennedy, the final analysis, we focused on Dr. Mantik's work as a radiation oncologist. He's looked at the JFK skull x-rays more than anyone else, did optical density measurements of those x-rays, and proved with forensic evidence, scientific evidence, that the 3 x-rays have all been forged to mask evidence of frontal shots. And there are 2 clear frontal shots seen in the x-ray. It's a fascinating book. And it shows that Lee Harvey Oswald was not the lone gun assassin we've been lied to by the CIA and the government for 61 years. Now, that was important because Ted Fogarty was a doctor, radiation-trained doctor, very close to Bobby Kennedy. And Bobby Kennedy wanted the book screened by Dr. Fogarty to see if Dr. Mantik's work was legitimate. Dr. Fogarty examined it. We gave him all the evidence. And he told Robert Kennedy Jr. the book was 100% accurate, and he supported the analysis without qualification. And that's when I began to develop beginning direct contact with Robert Kennedy Jr. I was thrilled to see Donald Trump reach across the aisle and shake hands with Robert Kennedy and bring him into the second administration. And now with David Hartsuch, we're going to get a vision as to why this is so exciting and how it means a fundamental change in the way medicine can be and should be delivered in the United States and worldwide. I think this is the beginning of a God event, and we are going to do everything we can to focus it, explain it, and get it promoted. So, Dr. Hartsuch, thank you for joining us for the second segment.
It's great to be here, Mr. Corsi.
Okay, now I want to begin with we're going to talk about hyperbaric treatment. And hyperbaric treatment is best understood by people. I think everybody understands that when you go, for instance, deep sea diving and you get too far down and you come up too quick, you've got to decompress. In other words, your blood's now going to have oxygen in it. The oxygen's got to get out of your blood. So you go into a chamber, a sealed chamber that's a high pressure chamber. The air is compressed in there, so you're in a high pressure environment as you would be if you were deep in the ocean. And so your blood gradually the pressure can be released so that your blood releases the oxygen in a natural way. And so that you don't suffer any major consequences, ill effects from the exposure of coming up too fast from deep depths and not giving yourself time to decompress. Now, what Dr. Fogarty has championed is it turns out there's a lot of therapeutic effects of hyperbaric treatment that are not known to the public. And I run telemedicine companies. I run several of them. We're revitalizing them. And I'm going to take one, which is getlongevitymeds.now.com, or getlongevitymeds.com. It's about to be publicized and brought forward that will focus on hyperbaric treatments. I want hyperbaric treatments to be available across the United States. I think this is something that Robert Kennedy and Doctors Fogarty and Hartsuch will agree on. And so I always say, my PhD is in political science from Harvard. I have a PhD in political science, but I am not a medical doctor, and I don't try to practice medical science, especially not with myself or anyone else. So, I also say that Donald Trump owns Bedminster Country Club not far from where I live. It's got a beautiful golf course, but I'm sure he did not design it. And if I had the opportunity to design Pebble Beach or Malibu or some other gorgeous location, I guarantee you I would not design the golf course. I'd go find the best people in the world to design the golf course, and I'd say, you figure it out to tell us what we're going to do. So with my telemedicine, when it comes to the hyperbaric, I'm going to hand this over to Robert Kennedy Jr., to Dr. Fogarty, Dr. Hartsuch, and they're going to figure out the plan. And then owning the companies, I'll figure out a way to implement the plans and get them delivered through telemedicine and clinics and whatever they come up with. Mm-hmm. Today, we're going to focus on why this idea makes sense. So having set that kind of structure and basis for the interview, I want to start here, Dr. Hartsuch, and that is, I think, and I'm sure you will agree, that one of our primary goals has to be to put the patient at the center of control of their own medicine, their own health. In other words, we are now in a system where the government is increasingly controlling it. The independent practices since Obama have been bought out. Doctors are now working for conglomerate health organizations in which they don't have the control they did. And so I'm just going to give an open-ended question to you, Dr. Hartsuch, and say, just begin. Why should the patient be at the heart of their own medical treatment?
Yeah. The most important ethic of medicine is informed consent. In other words, we don't do anything to the patient unless they consent to it. We don't strap them down and take out their appendix. Even if it's good for them, we don't do that. It is up to them to say, I want it, take it out. And this is true across the board. But what has happened is our institutions have substituted their own sense of right and wrong for what the patients have done. And so what the patients want. In other words, patient consent. The problem we have is that we have a medical system where the science is supreme and the patient is second rate. And so,
I mean, for instance, I've had people in my family develop cancer, and they were given opportunities to go through very painful and extensive therapies that may or may not have been successful. And some chose to do it and some chose not to do it. Some said I would rather take the last period of my life, and I know I'm going to die, but I would rather not go through poisoning my body in order to try to survive. And they were allowed to make that choice.
Yeah.
What do you think of that?
When I was in the medical school, I was there was a lot of AIDS patients up in Minnesota where I trained, and there was one particular one who was shaking like a leaf when I talked to him, and I asked him. I said, "Are you what's the problem?" He said, "I'm scared because I really don't want to be here." And I said, "What are you scared of?" "I'm scared of all the things they're going to do to me." And I said, "You know that you don't have to have anything done to you unless you want it done." And when he said that, all of a sudden he calmed down and he felt in control. And at that point, we could deal with the issue of therapy for him. Up until that point, if he thinks he's just passively subject to a machine which is going to operate on him or do whatever, then if he's not in control, he is not going to want to go along. He doesn't trust the system. One of the most important things that we have right now going on in America is a loss of trust of patients in their doctor. And the reason is we've undermined that informed consent of patients. Doctors are now controlled in such a way that they don't necessarily answer to the patient. This was the center of managed care for so many years, and we've now had close to 50 years of managed care, and we now have to question: do we really want to continue with managed care? Because at its heart, it does undermine the a patient's informed consent.
When I was a child growing up in East Cleveland, Ohio, my physician was a guy named Dr. Wyckoff. Now, he was born in the 1880s, and my mother would take me to see him. One of the incidents my mother related to me when I was a baby was that she had brought me to see him in a baby carriage, infant. Of course, in those days, there was a family physician, and the family physician treated the whole family. And Dr. Wyckoff had treated my mother's parents, her as a child, and now her married, and me as her child. So he knew the family. And my mother brought me in summer, and I was all bundled up, and she didn't want me to catch cold. And Dr. Wyckoff evidently took one look, and he said, "Mrs. Corsi, why do you have this kid all wrapped up like this? It's summer." And she said, "Well, I don't want him to catch cold." I said, "If you're warm, the baby's warm. So if you don't have a coat, the baby doesn't need a coat." Now that was such common sense, okay? That was such, but it took Wyckoff could take a look at you and tell you whether you were well or not.
Yes.
Okay. Now today I go into the doctors and I have a doctor who's been a personal friend. I consider him to be quite competent, quite good, but he's in a big healthcare cooperation. He had to sell his private practice. So now I come in for my annual check, and I've had this bronchitis I've been working to get rid of for months. I'm sure it's a weaponized form of pneumonia or something because I can't quite get rid of it. I'll get rid of it eventually. It was gone for a while. I got all stressed out working for the campaign and everything in the election, so I got run down. At any rate, first they say, okay, now of course you're going to come and do blood work. So I come in and take blood work. That's in anticipation of the visit. The blood work all shows up in my chart electronically, and I can see the blood work. And I come in and see the doctor, and the doctor says, I've only got about 20 minutes scheduled. And so the doctor's in, and the first thing he does is he said, "How are you?" et cetera, et cetera. The nurse has already weighed me and taken my blood pressure. Usually the nurse takes the blood pressure wrong, and she has to do it again so it gets it right. And then he sits at his computer. He starts looking at all the blood work ratios and asks a few questions and compares those ratios to ratios of similar blood tests in past time to see progression of things he's watching. And then he checks my meds and gives me new meds. At the very end of the examination, he may take his stethoscope out and listen to my heart and see if my lungs are clear. And then it's time. Then he says goodbye and he goes. Okay, now that has nothing to do. I might as well be. I didn't have to be there for that.
Correct.
And it was no patient-doctor interaction. I mean, he barely got the chance to say, "What's going on in your life? What are you worried about? What's happening?" All the things that a physician would normally want to know to say, how is your life circumstances affecting your health?
Yes.
Now, what's your reaction to that story?
I think this is a very common story that most people have had this same kind of experience with the doctor. They take you, they put you in a small room, they have you stripped down to your underwear, and you wait there in an uncomfortable fashion. And the doctor comes in, has a very short interchange with you. Here's your prescription, then leaves. And I would say that the fundamental problem there is that we have turned medicine into a transaction as opposed to a relation. This is the issue of, are we relational or are we transactional? The transaction is that we go have an office visit. Office visit. What is an office visit? Well, you sit in a room in your underwear until the doctor comes in. There we go. There's the transaction. And you get a bill for that. But the reality of it is, as doctors, what we are trained to do and what we should be doing and what we need to reestablish is that we need a relationship with a patient. That is the key, because we are going to be there to help guide the patient through the myriad of health decision making. And if we're not, we are not providing something of value to the patient. And keep in mind, when I use the words, something of value added service. What value added do we give to patients, except that we can relate to them and help them with their health problems as if we suffer with them. Compare that when we're paid by a third party, all we care about is getting paid by the third party, and the patient becomes incidental. And so I often say that the definition of a patient is anyone who accomplishes or facilitates the transmission of money from the third party payer to the provider. It's a very cynical point of view, but I think that's where we're at.
Well, I mean, so much of medicine, certainly in my experience, so much of health has to do with a lot of elements that are really psychological.
Yes.
In other words, the real problem may be that I'm having a problem with my wife, or I'm having a problem with my child,
Right.
or worried about money, or that,
Right.
There's some issue that in my mind, and the doctor decides I may be suffering depression. He say, well, I've got this medicine tranquilizer to get you over it. Well, I don't want a tranquilizer to get over. I don't want to just forget about that problem. I want to solve that problem.
Right.
And
what frequently happens in the emergency, I'm an emergency room doctor, is that the thing that takes the longest amount of time is due to a failure of the doctor to elicit the chief complaint. In other words, what is really bothering the patient? And if you don't do that, you're going to end up doing a whole bunch of tests and all this thing because you haven't figured out, why are they here? What is the thing that is causing them to be there? And you're right. It is oftentimes, it may not even be a medical problem at all that's bringing them in. Of course, sometimes it is.
Well, or maybe a non-medical cause that has created a medical problem.
And that,
Uh,
yes,
and usually, when I compare, I'm 78 years old, so I've been doing this for a long time with doctors. And so compare decades ago, good physicians, first they come in with their charts and their white gowns, and they'd sit down and they'd look at it and say, "Why are you here today?" That'd be the first. What's going
yeah,
on? What do you need? And then they'd start,
yeah,
because you open the discussion, and they don't know what you're going to say, but wherever you go, they say, "Okay, let's go there,"
right,
and to start to figure that out, the discussion will lead to other things, which So the doctor, traditionally, the physician, for most people, served a psychiatric or a psychological role in the treatment of the illness, which involved the doctor's subconscious, other dimensions of the doctor's creativity beyond the medical knowledge, because you're first tapping the human knowledge to trigger the medical knowledge. At least that's what I experienced. Would you agree?
I would entirely. And the thing about it is, we've tended to compartmentalize disease. So that, okay, here's a cardiovascular problem. Here's an orthopedics problem. Here's a psychiatric problem. Oh, if you're having and so when somebody comes in, and let's say they have a broken bone, some chest pain, and they've been very depressed because their wife left them. Okay, that's a good example. Well, which is it? What's the chief complaint here? Instead of looking at the person, the whole needs and what they need, and it might be that, hey, it's the psychiatrist isn't what you need. You probably don't need to be on an antidepressant,
Right.
and it might be that your chest pain that you're having is anxiety. But what I'm saying is, it's a matter of the doctor's role to figure out what is the best course of action that's going to address all those problems if they can be addressed.
Very few people need to go. Maybe nobody needs to go through Freudian psychiatric analysis. This is even good psychiatrists will say, "What's the problem?" And let me give you some ways to handle that problem. Well, I'm
Yeah,
worried I'm going to fail at school, and I get so worried I can't pass a test because I'm all the time. Well, worrying doesn't help you pass a test, so quit worrying.
right, right,
Won't improve your grade. So it's going to be whether you learned it or not. So quit worrying. Just focus on what you know.
right.
They'll probably
But
improve. That's a workaround.
I remember during medical school, there was this one gal who was very depressed, who everything was bad, and none of the psychiatry residents wanted to even talk to her because she just made you want to, and so they sent me as a medical student to talk to her. And we were talking and talking and about all of this medical problem that she was having and all this stuff. And I asked her the question, what gives your life importance? Okay. And she said, well, I take care of this kid who is physically disabled, and he was like in a wheelchair and all of this stuff. And I care for him, or at least I used to. And I said, what do you mean used to? Oh my God, she said. I've forgotten, but they let me go this week. They fired me. And so I'm no longer. And as soon as she realized that, and she kind of blocked it out of their mind, nobody knew this was happening to her. And at that point, she was made well. She did not have the physical complaints because she knew it and she understood it. She could rationalize it. But she was admitted as an inpatient in the psychiatric ward. And so that, I think that story tells me, I mean, this is exactly what you're talking about, that when people are felt, if we're not just dealing with problem solution, problem solution, problem solution, but when you get to that root cause, that's when real healing takes place.
And it's a complex process. And
Yes.
and when we get to let's go back to the computer that my doctor looks in front of. he said, okay, here's the blood work. This is what you're allowed to do. You can do 1, you can do 2, you can do 3, you can prescribe this medicine, this medicine, this medicine. Don't go off the script.
Right.
No, you say, wait a minute, well, I'm going to do something different. I mean, I'm the physician. I can prescribe something off label as long as it's an FDA approved. I can use any medicine I want to use. I can use any treatment I want to use. Nobody says I can't. So you try that, you put that in the machine. The next thing you know, you get a phone call from the hospital administrator that wants to see you.
Yes. Currently, I am in the practice. My practice, I don't take insurance, and people come to me, and I have no one to answer to. And the solutions that I propose are far different from the traditional doctor uh, insurance based practice. Okay. As an
Well,
example, yeah, go on.
go ahead. You give me your example. I want to hear your example.
Well, example, a lady came to me and she had an accelerated heart rate rhythm. Her heart rate was around 120s. And I said, gee, you've got atrial fibrillation and tachycardia and all this. I said, how come you're not on a medication to control it? She said, I don't want to be. I don't want any medication. I said, well, it is gonna help you. You should be on rate control. But I told her, I said, but if you really want to, and you insist that you're not going to use medication, take a lot of garlic in your food. So she started taking garlic. Garlic is comparable to a calcium channel blocker in its action. And so the next time she came back, her heart rate was normal rhythm. And she said, ever since I started taking the garlic, my heart rate has been under control. Okay.
About 25 years ago, I had a doctor who said to me one day, he said, you need to lose 50 pounds. You let yourself get out of control. Well, I decided I actually lost 100 pounds. I did it over several years in a systematic way where I reduced what I ate, etc., did it methodically. And that solved a lot of health problems because the problem was I was vastly overweight and allowed myself to get there through other psychological problems. Eating was a substitute for this. I mean, all kinds of issues that I had to sort through. But the fact is that, not everything is going to be solved with a pill that the machine tells you can prescribe, because some pharmaceutical company wants that pill sold so they can make money.
Right.
Oh, okay. Now go ahead.
We should talk about hyperbaric, I guess.
Well, I'm going into that right now. So
yeah,
people come to you, and you've got these chambers, these hyperbaric chambers. And I suspect very few of your patients have ever been deep sea diving.
Right.
So they don't need. They say, "Why am I going to go?"
They are coming for the bends. Yes.
Yeah, I don't have the bends. I don't need to go into this. I don't even like to take a bath. I don't swim. So why am I going into this? So where do you go from there?
Right. So the first patient I ever had what was called a plantaris tendon rupture, and this is very common among baseball players. He was playing softball, and when he went to run, you hear an audible snap like this, coupled by swelling and pain in the foot. And his dad described this to me, and I heard firsthand the story. Now, normally, if he comes in the emergency department, we do an X-ray, and we say, "Oh, the X-ray looks good. You can go home now. Goodbye." Okay. And yet we've done nothing for him other than to assure him that he does not have a broken bone. But I can be sure that he does not have a broken bone because this only happened. It's a very classic audible snap. It was not really traumatic, and he ends up with this very painful, swollen foot. Well, anyhow, I put him in the chamber instead of getting the X-ray and that kind of workup. And when he got out, it felt much better. And the next day, when he came back to get another treatment, he was walking with just one crutch. And he said, and the swelling was down. The swelling was all better. I put him in the chamber again. And he got over the course of 5 days. Now, normally this injury takes about 6 weeks before it's all better. Okay. But within 7 days, he was all better entirely. And that's pretty amazing that happens. And what I've done a lot of is when I find out something works that I don't know why it works, the one thing I want to do is find out why it works. And so I've researched a lot about hyperbarics, and quite frankly, Ted Fogarty and I, and along with Paul Hartsuch, I think our view is that uh, it's the pressure, not the oxygen. Everybody thinks it's the oxygen that is the problem. I had a young child who I think he's 7 years old, who drove from Cedar Rapids out here, and that's about an hour and a half drive. And his parents brought him out there because he had seizures all the time. He had cerebral palsy, and I treated another girl with cerebral palsy. Anyhow, this child had about 3, 4 seizures a day, and I put him in the chamber, and his seizures immediately fell down to 3 or 4 a week as opposed to 3 or 4 a day, which was a big relief to the parents. And over the course of perhaps 4 or 5 months, his cognition improved, and the parents went ahead and bought a chamber, so they give him that treatment at home. There's another girl. She was 4 years old. Her mom lives about 4 hours away. It's a long drive for them to get to my clinic, and her mother had heard about Eden Carlson. Now, Eden Carlson was a girl who fell into a pool, and this was in Tennessee, and she basically near drowning to a point where she was kind of vegetated. She was very vegetated, in fact. And she was discharged from the hospital after 6 weeks. But then what happened was she heard about Paul Hartsuch, who's an expert in the area of hyperbarics. I would regard him as the Moses of hyperbarics in our country. And he put her in a chamber at room air, 1.3 atmospheres, so just 30% higher than atmospheric pressure. And I think it was the course of 6 weeks, she returned to normal neurologic status. She was running, talking, the whole thing.
I mean,
Eden Carlson.
it's remarkable. I mean,
Yeah.
Does the pressure allow the body to heal itself? What's happening?
Well, there's two kinds of. Well, here's the difference. So every other doctor in America believes that it's probably the oxygen. It's more oxygen delivery to the tissues which stimulates their production. But the reality of it is, oxygen is toxic to the human body. We have this is well defined by the Navy. The Navy has determined that over time, Navy sea divers who are given higher levels of oxygen end up with dementia, and they end up with pulmonary dysfunction. And so the Navy has tried to mitigate oxygen exposure, but in our insurance realm, shall we say, the insurance will only reimburse if it's 2 to 3 atmospheres of pressure and it's 100% oxygen. Those, according to the Navy, though at those levels, oxygen is toxic in 15 minutes of exposure. But the insurance companies will reimburse for up to an hour and a half. And most treatments of hyperbaric oxygen are given an hour at least, and often an hour and a half to maximize the revenue.
Right.
And the reality of it is, when we're subjecting patients to such high levels of oxygen, it is to their detriment. Now, we are treating things that are so important, like carbon monoxide poisoning, cyanide poisoning, severe anemia. Those are the things that they treat in the hospital for. And so if you cure those things, nobody cares about what the result is in terms of dementia or pulmonary toxicity. Whereas what I do in my clinic is mostly on room air, so it's lower. I don't give high levels of oxygen, and the reason why hyperbarics works is the pressure, and this is what Dr. Fogarty I think has impressed upon me, and mathematically, what I've done is proven this to be true mathematically. So in your body, there are two types of reactions. Synthetic reactions take let's say two molecules, bring them together to form another molecule. Okay. And whereas a lytic function takes one molecule and breaks it apart into two. All right. Now, if you take one molecule and make it into two, you have raised the pressure in the surrounding environment. Okay. If you take and put a person under pressure, it encourages the synthetic function of the that are in the body. Simultaneously, it inhibits the lytic functions of the body. Okay? That is why this thing works. But if you take a look at it, probably myself, Dr. Fogarty, and Paul Hartsuch are probably the only doctors that believe it.
Well, it doesn't mean you're wrong.
No, I don't think it is.
And the point is that that you've had experience. I mean, it's remarkable to me as I've known Dr. Fogarty and talked about the cases, things you would never think could be reversed are being reversed. Alzheimer's is being reversed.
Yeah. Alzheimer's, yes. In fact, I took learning disabilities, children with learning disabilities. I've had a child, she's 7 years old. I'm sorry, she's 10, which is like third grade. And she would frequently have to be put in the quiet corner because she would have emotional outbursts during class. And I asked her, I said, "So what's going on?" And she said, "Well, it's always when I have to do my homework. And when I look at my homework, I just don't know what I'm doing. And I scream. And when she screams, the teacher puts her in the corner." And I said, "I think we're going to be able to change this." So 5 treatments, 1 hour, 1.3 atmospheres on room air. And with the first treatment, she never had to go into the quiet corner ever again. 1 treatment. Okay. And she got a total of 5 treatments. And after which she went from a DF student up to an AB student. Amazing.
Well,
And I've started doing, yeah, go ahead.
Go ahead, please. Oh, I didn't mean to interrupt. Please.
No, and it helps with broken bones. For instance, there's a paper that shows that under pressure, pressure encourages what are called osteoblasts, which heal bones, and it discourages osteoclasts, which break bones down. And that's what got me thinking more about this business of lytic versus synthetic functions of the body and what are done. And so what I had done in the case of Eden Carlson was this girl who fell in the water and got better. Well, Dr. Fogarty, who's a radiologist, imaged her mind and showed that there was actual brain growth over her course of treatment of 6 weeks. Now, we are taught in medical school that the brain does not heal itself. It does not grow. It is fixed. And so when there's damage to a brain, nothing you can do about it. And what that showed is that notion is entirely wrong. So what happened was this girl who had cerebral palsy, severe cerebral palsy. The mother called me up. She lived about 4 hours away and said, "I saw this case of Eden Carlson. My daughter has cerebral palsy. She can't roll over. She can't feed herself. She can't vocalize in any way. She basically sits there. And the neurologists think that there's nothing that can be done. And this is a mother who spent most of her time crying because there was nothing that could be done for her daughter. And she asked me the question, do you think hyperbarics would help my daughter? I said that I think it would, but I can't be sure. And I always give the first treatment free. In someone like that, I give the first 5 treatments for free so that the patient gets an idea of what is involved and what the benefits might be. And I often tell patients after 5 treatments, if you feel that it's not a benefit to you, then maybe you should stop. All right. And so, anyhow, this girl, she got a total of 55 treatments. But today, this was a year ago, in fact, she walked around in a gait trainer. She fed herself, and she was verbal. The first words out of her mouth were to her mother. She said, "I love you." And these are things that can't be denominated. They don't enter into play in any institutional view of medicine because the
Yes, go ahead.
institutions can only deal with the utility of things. They have a tough time dealing with what is the value of what I'm getting.
Well, there's also, a lot of issues that have to do with the constructs of how we consider things. In other words, where there's a certain logic or methodology of how medicine is constructed. So people are looking at it a certain way. And a good example of that would be that, the psychology is not usually taken into consideration in medical treatments. We've covered that.
Right.
A second is that there's a lot of dynamics going in the body. One that's fascinated me for a long time is antioxidation.
Yes.
Which is a complex issue in chemistry because certain of your atoms can lose an ion, they can lose an electrical charge, and it floats around in your body as a free radical. And those cause damage,
right,
which ends up aging people. So an antioxidant goes around and it collects these free floating electrical charges, captures them so they can't do any more damage. Now, there are antioxidant agents that are being looked at. I have been using this carbon-60 for a long time, and it's a very effective antioxidant agent. It's one of my sponsors on thetruecentral.com and do more with it. But again, that's not until recently, the chemistry of the body, which you're discussing in terms of these molecules coming together and breaking apart, which is fundamental to whether the body's functioning correctly or not.
Yeah.
Is not in the act. It's not in the. You're not going to be taught that in medical school because it doesn't fall into the logic of what they think medicine's about.
Right.
If the logic of medicine becomes about the rules the government allows you to apply in order to sell pharmaceutical drugs, we're going down the wrong path.
Correct.
You agree with that?
It's kind of absolutely, and you're talking about the oxidants. Most of what I do in my clinic, I've realized it relates to oxidation.
Right.
The difference between something that is living and inanimate is that everything that's inanimate universally breaks down and is unable to heal itself. Something that is living heals itself, it synthesizes, it has a synthetic function that can be done. That is what delineates what is living versus what is inanimate.
If we promote that synthetic function, the body can rejuvenate itself.
Correct. And that's what hyperbarics does. That's what glutathione precursors are.
Right. Well, I've got some.
Yeah, exactly. We should.
I got some right here.
I might as well do the same thing. I do it too. Okay.
This stuff is really this this stuff works.
Can we say the word ProImmune?
ProImmune, yeah, and it's available.
Yeah.
We'll have it on our websites pretty soon, but ProImmune, it works. And
Yeah, but
it's,
I do. The other thing I do frequently is the hydrogen water bottle generator. Do you have one of these?
I don't know.
Okay.
You'll have to turn me on to
25,
that.
$30 on there. There's no particular trade name. There's a bunch of them. Hydrogen is a big antioxidant. I also encouraged my patients to use red light therapy. Red light therapy is anti-inflammatory. I highly recommend that you include 100 to 200 grams of whole grain in our diet. This is directly contrary to what every other doctor
And how
thinks.
about, the gluten-free diets would be anathema to them.
Well, yeah, it's kind of funny, but Ted Fogarty and I have many discussions about gluten. I'm a pro gluten person. He's an anti gluten person. I baked him some gluten free bread. He loves it. I don't. I
Yeah,
love
well, it's got
gluten free.
glutamine in it,
Oh,
and,
glutamine. It's glutamine. Glutamine's yeah, but that's not gluten.
that's not gluten, okay.
No, no, no. Gluten
But
is a
this stuff is also selenium, which is really very
yes.
powerful.
Yeah, selenium is an antioxidant. I think the best way to get selenium is by eating Brazil nut. One Brazil nut a day will give you adequate selenium in your diet. So the other thing I do is a lot. And by the way, most of these things that I recommend to my patients, if you had asked me this 4 years ago, I would have said, "I joke. What a joke!" In other words, I was pretty much like every other doctor. But what happened was with COVID is people were not going to the ER. And so the consequences, I was not working as much as an ER doctor. And so I spent all my time reading about these things. And I read lots and lots and lots of research papers, lots of them. And the thing about it was that's when I started reading about immunology and I read about virology and why are we sick? Honestly, most of it is related to oxidation, misuse.
Yeah.
Yeah, and these antioxidants. Ted Fogarty, I think he's given me a great appreciation for glutathione, which is
Yes,
the master antioxidant of our body. And
glutathione is very important, and
right.
this is
So
this ProImmune assists your body in producing glutathione. That's one of the
right,
fundamental
right,
benefits of this. And
right.
I'll just say,
So
I read the medical literature. I mean, I'm not medically trained, but I read the medical literature. And so when I met Dr. Zelenko, I said to him, "Well, why is this formula with hydroxychloroquine and zinc working?"
yeah.
He pointed out to me that the dynamics of this was that the hydroxychloroquine basically opened up the cell, and the zinc was doing the work.
Hmm.
And I said, "Well, why do you have it with azithromycin? That's an antibiotic. If you're dealing with a viral disease, why do you have an antibiotic?"
Mm,
And he said, "Well, it works." And
right.
they started talking about anti-inflammatory, and we started getting into the ivermectin, and we realized I began to think about how inflammation the lungs
Yes.
were experiencing in COVID
Yeah.
with this 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 cytoplasmic storm that builds into the lungs where the inflammation just kills you.
Yeah.
The need to be conscious of antioxidation, anti-inflammatory, these various and boosting of the immune system, so the body begins to restore the capacity to heal itself
Right.
despite aging.
I think what you've just articulated is that you have a better understanding of this process than 80% of doctors.
Well, I mean, I read the medical literature like you do, and
Okay.
I've had very good people pointing out to me which medical literature to read.
Hmm.
As I study it and think about it, you know, I, one of the things I could have I did very, very advanced math when I was in high school. Never took another math course. I taught advanced. I taught advanced statistics. Never took a course in it. I ran randomized field experiments for the federal government, the National Science Foundation. Never took a course in research design.
Mm-hmm.
I read the quantum physics and other. I never took a course in physics beyond high school.
Okay.
Because, it's, and I can't explain it except that it's a gift.
Let me explain what hyperbarics does with glutathione.
And one point I want to make before that is that I think that not having this Thomas Kuhn and his whole idea of scientific revolutions. Most scientific revolutions occur from people who are not trained in the field.
Yes.
People who are trained in the field are trained to follow the paradigms of the field.
Yeah. Yes. And in fact, I would say that it's interesting to look at Paul Hartsuch, who I have a great deal of respect for, and look at Ted Fogarty, who is a radiologist.
Yes.
And so the major contribution
and yourself, who is
but the major contribution
with mathematics to begin with, dealing with medical
mathematics. Good example. Ted Fogarty and I think have a different view in terms of what's happening. I'm thinking more mathematically. He's thinking more qualitatively as opposed to quantitatively. But the key here, Paul Hartsuch wrote a book called The Oxygen Revolution. But if you read the book, it's not so much about the pressure, about the oxygen, it's about the pressure. And what happened,
by the way, deoxidation has nothing to do with oxygen. Deoxidation is about ions and it's electronics. It's that
right.
They thought in a mistake made, 200-300 years ago, thinking it with oxygen.
So,
and again, you're pointing it out again. So when we talk about deoxidation, the first thing you got to explain is this has nothing to do with oxygen.
Well, it kind of does. I mean,
it kind of does, but the fundamental, it's interrelated.
Well, it's redox equations. Redox.
There's
two processes. Something is reduced and something's oxidized. Okay.
Yes.
So there's a thing called oil rig, and that is oxidation is leaving. In other words, the electrons leave, and reduction is gaining electrons. Okay.
It's complex.
It's complex. Okay. But what's interesting about glutathione, which is very unique to everything, is that when you take two glutathione, what is called GSH, and you bring them together, it forms GSH. And in doing so, it gives up an electron. So therefore, it's oxidized. And that's not normally the case. Normally, when you break something down, that's when it's oxidized. But glutathione is the opposite of this. And so when you put a person in a pressure chamber, you're encouraging glutathione to become oxidized. And in doing so, it has to reduce something else. Everything else in your body gets reduced, which is what you want. You want your body to be as reduced as possible, because reduction is antioxidation.
Yes.
And that's why this hyperbarics works so well, because what it's doing is it's acting as a super antioxidant. It's like an antioxidant scrubber.
Well, that's where I think you're right, because these two ideas of, carbon-60 and the hyperbaric treatment, I'm going to combine on these websites, because I think the one facilitates the other, that they can work in combination together.
Yes.
And
in fact, yeah.
And adding in, this ProImmune, which I think is just remarkably brilliant composition and works. And so these are things that we can get to people. We will get to people in a simple form, but it's going to be outside the medical establishment, which I think needs fundamental rethinking.
Yeah.
It's becoming a bureaucracy. It's
Right.
becoming a big government control mechanism.
Right. One of the things that I think has happened with science, the science of medicine, that's bad, is that the FDA requires randomized controlled trials of everything. Right. Placebo controlled trials, which means that all of our medications are better than nothing. But placebo is nothing. And so our medications are better than nothing.
Well,
And I know,
to explain that, when you do, because this is what I used to do with randomized field tests in social science, your the entire scientific method is based on saying that your new treatment applied randomly has no difference
yes,
doing nothing. Okay, so the only thing you prove in a scientific experiment is that what you did is different from doing nothing.
exactly.
And that doesn't mean it's better, doesn't mean it's worse, doesn't mean people liked it better, it just
Exactly.
means it changed something.
Right. And so if you look at the hyperbaric randomized controlled trials, so what do you use for control? They've used 1.3 atmospheres of air. No, so no oxygen. Compare that with 100% oxygen with 2 to 3 atmospheres of pressure. And when they do the experiment, they found out there's no difference. And so their conclusion is hyperbarics doesn't work.
Right. Yeah. Okay. Which is the flaw in the scientific method, not in the treatment,
Correct.
because they
Correct.
asked the wrong question
Right.
and they said it
Doctors,
the
yeah,
wrong way.
doctors have to understand this. Doctors have to work through the literature, et cetera. And quite frankly, I think that the current healthcare scheme has been mind numbing for our doctors. And the result is that most doctors are just going through the motions instead of doing what they're supposed to do, and that is think about what's happening with the
If
patient.
the doctor did not go into medicine to sit in front of a computer and read numbers and tell it do what the government told it to do.
Correct. Correct. We are trained scientists, and we are to use our ability to the best of our ability to help the patient, not the organization we work for.
You went in to heal people.
Correct. Correct.
The traditional country physician would take a chicken to heal people. That was their payment.
I have done this. I
Yep.
Many people. I think, and actually, for me personally, treating someone for free is a blessing, and I'll tell you why. Because when I work in the emergency department, I'm working for a hospital. They're billing for my services, and so therefore, I've sold my ability to render healthcare to anyone I choose. Right? As soon
You
as I as soon as I render healthcare in a hospital, they send a bill to that person and to their insurance company. In my clinic, that is not the case. If somebody comes to me who is destitute and they need my care, I can give it to them without having to worry about this.
you
And this
go to
is
a
a real
hospital. Go to the hospital. The first place you're going to get sent is the administration. They want to see your credit card, your social security number.
Yep,
They're going to register you and make sure you can pay. Do you have insurance or not?
right,
And that sets out the treatment you're going to get.
right.
That's the wrong way
My
to do it. And
Yeah,
if you government that is determined that their real agenda is we've got too many people in the world, they're going to kill people. The medicine start getting applied not to heal people, but to keep them sick and dependent on medications, and ultimately kill them and to get rid of them. We've
yeah,
got a real problem.
yes. We are now in a position where our industry, here's the medical problem, here's the solution, here's the problem, here's the solution. We have a drug for everything. And so the role of the provider, and I'll say provider because it's not just physicians, it's nurse practitioners and physician assistants, a whole bunch of others, and says, okay, here's the problem, here's the solution. Whether the solution works, we don't know, you know. If it doesn't work, it doesn't work, you know. But that's all we're offering. Okay.
Yeah,
I
and
don't think America can deal with this anymore.
it's not. We're not healing America. We're making America fat, obese, sick,
Yes.
and dependent.
And
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 then you turn on your TV, and you get these, this commercial and that commercial. They're dancing around with this drug and that drug and another drug, and then at the end they tell you in 20 seconds all the things that you can do to kill you, and you realize that that commercial has nothing to do with selling the drug. It has to do with providing enough money to that network so the network won't criticize Big Pharma because it doesn't want to lose the revenue.
right,
They don't care if anybody buys that
right.
drug.
I think hyperbarics will help people with psychiatric disorder. I've treated one lady with bipolar disorder. She's had it all her life, and she said, "Dave, this is the only thing that has ever worked." And I can explain it. I can explain that because there's a chemical in your head, what's called BH2, and that gets converted to BH4, and it's related to these antioxidants.
Well,
The oxidized.
if the body heals itself, it doesn't matter what your problem is.
Mhm.
And it has fundamentally to do with, processes like antioxidation, etc. Wherever you're ill, that oxidation process isn't working right.
Right,
And so you begin to improve the immune system. Your immune system is going to cure the problem, whatever the problem is.
right,
The fundamental thing that's going to keep us healthy is our immune system
right.
and the reactive system.
Keep in mind there are two immune systems. There is innate immune system and adaptive immune system. And the people who are manufacturing the vaccines pretend as if it's all one. And so, yeah, we're going to boost your immune system. We're going to boost your immune system. But what's happening is where if you give a vaccine, on the one hand, you're promoting a particular type of antibody, and simultaneously, you're removing cells from the adaptive immune system. And so over time, that adaptive immune system comes down. I'm not the anti-vax, but I would say that we have to start being judicious in terms of what the actual effect is of these vaccines on the adaptive immune system.
Well, just to kind of begin wrapping up, I'm excited to see Robert Kennedy getting charge of the health system in the United States. And I'm very encouraged to see that people like yourself, Dr. Fogarty, are being encouraged to participate in the intellectual creation of a new system of medicine that will put patients first. And I'm going to dedicate the telemedicine systems I've got to you guys designing the golf courses.
Yep.
So you guys figure out what the treatments are that we need to be, and we'll make them available to people through telemedicine support by clinics. If you want to get hyperbarics available all through the country, you'll figure out how to do it, and I'll help you implement it.
Sounds good.
Okay, it's been a very interesting discussion. I think it'll be one of many. Dr. Hartsuch, thank you for joining us.
I've enjoyed this wonderfully, Mr. Corsi. It's been very good talking with you, and I think you're very broad-minded in terms of your discussion here today. I enjoyed it immensely.
Well, we'll do more of it, and we'll do it more with others who can share their views, and we'll get a whole body of these programs built. So we'll reestablish a fundamental re-engineering of health in the United States and the world, where the patient comes first, and
Yep.
God is in control, not big pharmacy.
Yes.
Okay.
Good.
In the end, God always wins. God's going to win here too, and I encourage people in the spirit of 2 Chronicles 7:14 to ask God to repent for letting these Fauci demons think that they can tell us what to do and censor us and imprison us and kill us if we don't agree. It's got to come to an end. And we're going to do our best to make that happen. We've been given a reprieve with Donald Trump's victory. I'm rejoicing to see Bobby Kennedy Jr. and Donald Trump join forces. I had the good fortune of my life to have been able to experience personally Robert Kennedy and Bobby Kennedy and Jack Kennedy. And I'm delighted to be having the opportunity to work with the next generation. So I thank God that we're at this moment in history, and let's use this reprieve we've been given by God from these New World Order demons to send them back to hell and to get a new consciousness established worldwide where health and God come first. Thanks, Dr. Hartsuch, for joining us. We'll be back with more. God bless.
Thank you.